What if I told you that a bacterium living harmlessly on your skin right now could release a toxin capable of causing your organs to shut down within hours? That bacterium is Staphylococcus aureus, and in rare cases, it can lead to a life threatening disease called toxic shock syndrome. My name is Francesca Cavallero, and I'm doing my etiology presentation on staphylococcal toxic shock syndrome. I chose Staphylococcal toxic shock syndrome, or TSS, because it has a personal connection to my life after experiencing an infection that progressed to sepsis. Before researching this topic, I did not realize that a bacterium commonly found on the body could become life threatening. I wanted to better understand how Staphylococcus aureus causes disease and bring awareness to this rare but serious condition. Staphylococcal toxic shock syndrome, or TSS, is a rare but dangerous illness caused by toxins produced by Staphylococcus aureus. Instead of the bacteria directly causing most of the damage, the toxins trigger an extreme immune response that can lead to inflammation, low blood pressure, organ damage, and shock. The pathogen responsible for TSS is Staphylococcus aureus, a gram-positive bacterium in the kingdom Bacteria and genus Staphylococcus. It is a round-shaped coccus that forms like grape-like clusters and can survive with or without oxygen. It commonly lives on the skin and in the nose without causing harm, but can become dangerous once it enters the body. A unique trait of S. aureus is its ability to produce toxic shock syndrome toxic 1 or TSST1, which causes an excessive immune response. Toxic shock syndrome is not spread directly from person to person. Instead, S. aureus enters the body through openings such as wounds, burns, surgical sites, tampon use, or other breakouts in the skin. Once inside, the bacteria can produce toxins that trigger the symptoms of TSS. I personally experienced a buildup of bacteria in my pelvis that resulted in toxic shock syndrome. The TSST1 toxin produced by S. aureus acts as a super antigen, causing the immune system to become overreactive. This leads to a release of inflammatory chemicals called cytokines, creating widespread inflammation. This immune response can cause low blood pressure, tissue damage, and organ failure. I personally experienced low blood pressure, which caused me to go to the ICU. Symptoms of TSS can appear quickly and include high fever, rash, muscle aches, vomiting, diarrhea, and low blood pressure. Severe cases can lead to confusion, septic shock, kidney failure, and organ damage. A unique symptom is peeling skin on the hands and feet during recovery. I personally am thankful that I did not experience the hands and the feet peeling. However, what prompted me to go to urgent care, which resulted in me being put in an ambulance, sent to the hospital, was I was having high fevers up to 104.5 degrees. I had constant vomiting, diarrhea. Um, and then I had a ton of confusion. I ended up having hallucinations, and it is something I never want to experience again. TSS is diagnosed using symptoms, medical history, physical exams, blood tests, and cultures from possible infection sites. An unusual feature that is that blood cultures can be negative because this illness is mainly caused by toxins rather than a large amount of bacteria in the bloodstream. As for me, I'm not 100% sure how I got toxic shock syndrome. It could have been from a tampon, or it could have been from bacteria in the ocean, being that at the time I lived at the beach and did go to the ocean frequently. Toxic shock syndrome requires immediate treatment with IV antibiotic fluids and medications to support blood pressures. Doctors also remove the source of infection when needed. Severe cases may require ICU care, surgery, or IV immunoglobulin therapy. Early treatment greatly improves recovery. Me personally, I was admitted to the ICU because of my low blood pressure. However, my kidneys and lungs were starting to fail, as I did have a fever of 104.5, excuse me, and a heart rate of 180 beats per minute resting, and that is what urgently prompted the PA at the urgent care to send me to the hospital. Before researching this pathogen, I never realized that bacteria commonly found on healthy skin could become life-threatening through toxic production. I also did not know that the immune system's response to these toxins can cause severe damage throughout the body. I know for me, and I know it could be different for everyone else, but some of my effects I experienced after having sepsis was I had a lot of my hair fall out, which can be very depressing if you don't know what's happening. And I was caught off guard when it started happening, and it lasted about 2 months. And I know for me, it was very draining, and living on my own 4 hours away from my family was very difficult for me. However, it's very important to lean on your friends and, do things that bring you happiness so that you can get your mind off of the sad time. Furthermore, on my experience, I remember that all these symptoms worsened within like maybe 5 hours. It started with throwing up, and then it progressively got worse with like hallucinations, and the fever only increased. It is also very important to know that not all cases result in tampon use. I know when you think of toxic shock syndrome, you're instantly drawn to tampons, and however, that is not the only cause to having toxic shock syndrome. I wish I could know exactly and pinpoint what caused it so I can maybe avoid that, but I also know that I can't avoid it. It was just unlucky for me. Another important note that I wish I would have known sooner is if you are experiencing a fever that increases rapidly, if you're throwing up for 24 hours, please go to the hospital. I wish I would have done that as soon as I started throwing up because that wasn't a normal cause for me. And I just assumed I had food poisoning, which one might do. But it is also very important to stay alert in moments like that. Staphylococcal toxic shock syndrome shows how a common bacterium can lead and become a serious health threat. Understanding how S. aureus produces toxins and affects the immune system helps healthcare providers recognize and treat the disease quickly. Early detection and treatment are very key to preventing severe complications like mine. I do want to go a little bit more into my personal experience so you guys could get a better understanding of what exactly toxic shock syndrome was like for me. I was in the hospital for around a week and a half, and majority of that was in the ICU, where I was hooked up to multiple IV bags in the beginning just because they did not know what was wrong with me. After being moved to a regular medical room in the hospital, then we discussed what future antibiotics would be like for me. And I had a PICC line put into my right arm so I could administer myself antibiotics rather than having to go to an infusion center every single day to sit there for 2 hours, being that I worked full time living on my own, and I didn't want to do that because it would take away from work and my hobbies. The antibiotic I was on was penicillin G, and I know it can vary depending on what you're allergic to and what your body can handle. However, my antibiotic was stored in the freezer, and every single day, at the same time, I believe it was 10 a.m., I would take out the medicine and attach it to my PICC line, and I carried it around in a fanny pack all summer long. And I do have a picture of the pick line that was in me. However, I couldn't find it, but I know I took a photo of it. And the pick line measured 32 centimeters. So you can imagine that. And it was very thin, but it was noticeable in me. I could definitely feel it under my arm and stuff. Um, However, I'm very grateful to have the opportunity to do this project and have a better understanding of how the toxins are produced and how this affects my immune system and kind of exactly what happened to me. And so these are some of the references I used. And yeah, thank you so much. I hope you enjoyed my presentation.